good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions as well as addressing the latest in COVID headlines through today, the 13th of January. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion, as always, is Sophie Viskowski, who is our Student Research Assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
So for some updated COVID statistics, in the United States yesterday, we saw 851,000 new COVID cases with an increase of hospitalizations by 82%. Deaths are increasing by 51%. And we have yet to see a change in the fully vaccinated population. We are still staying at a steady 62.6% of the population is fully vaccinated. This number has not changed in probably about 2 weeks, which is rather sad. In Illinois, yesterday we saw 34,790,000 new cases with a death rate of 81% and hospitalizations at 50%. And Illinois is still sitting at about 65% of the population fully vaccinated. You know, I just spewed a lot of very, very sad numbers to you, Dr. Murphy. What can you tell us about what we're seeing with, like, when are we going to hit this, spike? When are we going to see the peak? What's going on?
Yeah, I wish I knew. But if you look at what happens in the UK and South Africa, they hit this kind of peak and they came down. Now, those countries are much smaller than the United States. The United States is, enormous, relatively speaking, and there are different mitigation strategies in different parts of the country. Some are very strict, some are very loose. And so, there's always something going on. And even different parts of states, like in Illinois, the southern part of the state is basically way under-vaccinated, and the hospitals have been full for quite a while, as have the ICUs. So, it's going to take a while for the vaccine to get through the population. Basically, everybody's going to get sick. Excuse me, my cat. Everyone is going to have to get through this wave, and to survive the wave and have the least complications, you have to be vaccinated and boosted. Doesn't matter which vaccine you got the first time, but you have to have a booster. The Omicron is a much different variant than the other ones, and that's what's out there. Over 90% of all the isolates now are Omicron. The other ones are Delta for the most part, and you have to be boosted. And so that's the way to protect yourself the most. And as you said, so only 62.6% of the people are fully vaccinated. That number's not even budging. That leaves an awful lot of people that are unprotected. And this is just going to happen. So when is this peak going to go down? So the virus is just ravaging the population. All those susceptible for the infection who are, mingling together and whatever, schools open, all this great thing, got to go back to school, got to spread it even more, because the vaccination rate is low in the schools. Only half the preteens and teenagers are vaccinated, and 12% of the kids 5 to 11. So that's going to just stir things up as well. Plus all these unvaccinated adults that don't believe in the vaccine. So it's going to rip through the population. So they're all going to get it, or most of them will get it. And then you're going to see the peak go down, just like it happened in South Africa and what's happening now in the United Kingdom and a few other countries that are, particularly the ones that are heavily vaccinated. So that's what's going to happen. And the original projections for this peak was to occur right about now, in this week, actually. And that's not happening. There are some signs in some cities, like even in Chicago, where the rate, because Chicago has a higher vaccination rate than the city, than the state, excuse me. The rate is decelerating. The increase is decelerating. So it's not increasing quite as fast. That's the first thing that happens. And then you see after that, flat, and then a complete deceleration. And so we would, now we're expecting to see that sometime in the next 2 weeks, or that's what the projections are. So this is going to be a very tough month.
Well, speaking of tough months, our biggest headline that Fauci said this morning is that, everybody is going to get the highly contagious Omicron.
Mhm.
What can you tell us about Fauci's statement and how it's going to look for the peak?
Well, I would say everyone in the United States is going to get it because the mitigation strategies are being implemented so poorly. And that has nothing to do with the federal government. It has nothing to do with the CDC, the NIH, or the White House, or anybody else. The public health care is managed by the states. We have 50 states and we have 6 territories with people in it. Each one has their own health department. Each one is making their own rules about mask mandates, about vaccine mandates, about mitigation strategies, opening of schools. Everybody's doing what their local, state, city public health department wants to do. Because of that, we're going to fail. Total failure. The United States is the big outlier. We have the most cases, we have the most deaths, we're driving this infection in the world. Countries in Africa are doing better than we are. European countries, it's kind of a mixed bag also, but many of them that have adopted the vaccines are doing better. And you'll see in the UK, Denmark, and a couple other places that they will handle this a little bit better. But they also have elderly population in Europe and people at risk. So, vaccines aren't going to work that good in those people. But anyway, we're just going to have to get through this. So Dr. Fauci's statement basically he's admitting we failed. So we have to live with it. How do we handle this without hurting more people than we have to hurt? Get vaccinated, get boosted. Upgrade your mask. Get those N or KN95 masks. Use those instead. Avoid mingling, number one, with a mixture of vaccinated and unvaccinated people, because the unvaccinated, they're basically all going to get it. And try to just use some common sense for the next month or so, and try to get through this wave. The wave will go down, like in South Africa, it's like plummeting, and try to get through this particular period, even though you're getting all these conflicting messages and whatever. But the best thing right now is these vaccines, and then of course the pills that have been approved are coming forward at some particular point. Haven't seen them yet, but they are approved. But it takes a while. You just don't flick a switch and get millions of doses of those tablets. They have to be manufactured and then distributed. And that's all happening now, but it's not going to happen overnight. That could be a huge game changer, though.
No, definitely. And, speaking of vaccines, et cetera, they are now saying that Pfizer, Moderna will produce vaccines and they could be ready by March. But will we really need them by March?
No, they'll have the vaccine by March, but they won't have the testing done by March. They're going to have to, the FDA is going to make them do clinical trials, and I don't know how long those trials are going to take,
Right.
But they have to come up with a different version of this. The current vaccines are barely hanging in there. So we need more vaccines, and because there's going to be other variants, as well, until this whole pandemic burns out.
Right. No, definitely. And a big headline that
One other thing I want to say, though.
Yeah.
The pills, the tablets, the oral therapies have actually been around now for a year and a half. And they were not prioritized by the government, which prioritized testing and vaccine development. They did a great job with those, and they basically blew off the pill therapies. And all these treatments are a year behind because there was not the push to get them out. They didn't think they were going to be needed. That, unfortunately, in retrospect, is a big mistake. But so now we're playing catch up. And so now when we need these things, the hospitals are jammed. And the pills are going to work in unvaccinated people too. So, now we're stuck for a couple months until they can get the manufacturing up. And they will, probably just as the cases are going down. But they'll be useful for the next round.
Right, absolutely. Now for another big headline, if you caught COVID-19 over the holidays, here's what you need to know. Dr. Murphy, are you less likely to get COVID again?
Yeah, you are, generally it's thought that you're not going to get infected again for at least 3 months. We didn't see breakthrough cases for 3 months. Now, the problem was Omicron. Omicron's so contagious and is so different from the other variants that you could have had the Delta infection over Christmas and get an Omicron infection now. That's been documented already, unfortunately. So, but with Omicron, I haven't seen anywhere, I don't know if anyone else has 2 Omicron cases yet, but remember, Omicron's only been identified for the last 2 months. It's only been here 2 months. So we'll learn more about Omicron reinfection shortly. But we think that once you've had that, you probably are protected for at least a couple months.
And you touched on this a second ago, but does getting sick with one variant offer protection to the other?
Well, it did until now. The other variants give you some protection, and they all give you some protection, but it's like a weak vaccine. And this Omicron thing is breaking through everybody who had prior Delta or Beta or Alpha or whatever.
Right. And lastly, what if I got sick but haven't been vaccinated or boosted? Do I still need to get a shot?
Oh, yes, definitely. The vaccines, the way the vaccines work is they present themselves in a form that has flashing lights on it, telling the immune system, oh, look, I'm an alien. And the immune system develops an immunologic response, including antibodies to the antigen, the hunk of the virus, which is the spike protein in this case. So the vaccine immunologic response is greater and more predictable than the actual infection. It does not sound intuitive. It sounds counterintuitive that you would think if you had the infection, you should have great immune response, but that is not true, and it's not true with many other diseases as well. So it's not a big surprise.
And now for our last COVID headline, the UK could be among the first countries to emerge from the COVID-19 pandemic. What are they saying about immunity in England and, emerging from the pandemic as a whole?
Well, the English have a much better tracking system than we do in terms of variants and who's infected. They have a national health service, so all the data comes into basically one place. It's kind of like our Medicare system or the Kaiser Permanente system or the Veterans Administration system here, who have these massive healthcare systems. They've got loads of data in there. But in these other countries, it's pretty much all centralized for the entire country. Now, of course, they're much smaller than the United States. We don't have anything like that. So they project that within the next couple months, that 95% of the whole entire population will have some kind of antibody to SARS-CoV-2, to COVID. They'll have COVID antibodies. So it remains to be seen when that happens, how good that immunologic response in the population, which is done by a combination of vaccinated, boosted, and people who've been sick multiple times, if that's going to be able to bring the whole infection rate down. Is it going to give them some kind of herd immunity to make it more difficult for the next variant to come in and take over? So it's an interesting population experiment, and we'll keep our eye open there. Also, Israel has the same sort of setup there, where they track everything, and they've got a population that's very well studied.
Right. And those were all of our COVID headlines. And now we move on to some questions. This individual experienced hearing loss after receiving or potentially receiving her booster. While she doesn't know if the two are linked or not, she would like to know if this is possible after receiving the COVID-19 booster.
Yeah. So neurologic events are associated with vaccines. This is possible. She should be under the care of a good otolaryngologist. This does also just happen in the population, so we don't know the cause and effect yet. But if it was temporarily related to the vaccine, she should complete a VAERS report, VAERS. It's a vaccine adverse event reporting system by the FDA. Anybody can file that. Their doctor can file it. A person can file it. You don't even have to be a doctor to file it. If the FDA thinks, if their toxicity experts think there's anything unusual about it, they'll ask you other questions about it. So I recently filled out one for a person who had a small stroke. It was within a couple of weeks of having the vaccine, and they contacted me and asked me more information. We had to get more information that we sent in. I don't know what happened with it, but because it's a voluntary system, you get everything, and it's not verified, and but it is just a way that people can report. The report will be looked at, and if they think that there's something there that they need to follow up on, they'll flag it and try to analyze those side effects. So it's that's VAERS. So they should fill out a VAERS form, and she should stay under the treatment of her ear doctor.
Great. And now for our second COVID question. This individual had COVID 3 times: one Thanksgiving of 2020, Easter 2021, and it says here yesterday, so we're going to assume in the last week or so. Each time was a PCR test. Each time they were symptomatic. They got vaccinated in June of 2021, but they aren't boosted, Dr. Murphy. What can you tell us about this most recent time that they could have gotten COVID? They're not sure if this would be a false positive, et cetera.
She had positive PCR tests and had symptoms that were very classic for COVID. So I think she had COVID 3 times. And yeah, that's possible. And she's not boosted. This vaccine works the best when you have your first 2 doses, like 3 or 4 weeks apart. And then you get your booster 5 months. Now it's 5 months later. It used to be 6 months, 5 months later. That's fully vaccinated. All right. So she's not fully vaccinated, but she brings up a good point. Having COVID in the first 2 vaccines is not enough. You have to be boosted. And so it's all possible because the new variants coming in are, she's probably had multiple different variants. Like a lot of people got beta. That was the second breakthrough they had after they were first infected. I had a couple of those patients, and then they got Delta, and then now they're getting Omicron, so, the pandemic's been going on for over 2 years now. So, we're going to see more and more cases like this. So stay up with your vaccine and keep up your boosters.
Absolutely. Now for our third question. This family has been very strict about mask wearing, no eating in restaurants, no parties, etc. They have been fortunate to never have gotten COVID. They have an unvaccinated 4-year-old who will be turning 5 in January. And they wanted to have a birthday party for her. And into this birthday party, there will be people coming. Is it safe for this child to interact with people inside, not wearing masks, and these are frontline workers?
Well, I think in this case, she's talking about a friend who just got over COVID in December. So probably that was Delta, but she's recovered. And I'm assuming that friend is also vaccinated. I can't tell here. But anyway, so if that's the case, it's okay to get together. And I think especially with the friend, and if anybody else is coming over that's not fully boosted and vaccinated, that they're going to have to wear masks in the house until this kid has had the 2 shots.
Wonderful. Now for our 4th COVID question. Can you explain why I tested positive twice with an at-home Abbott test, but went to a facility and both rapids were negative and PCRs? So 2 positive Abbott and 2 negative, 1 PCR. I had symptoms of being very achy, fever, congestion, fatigue, sneezing, and then loss of smell for 12 days. Why are we seeing a difference in testing and in positivity and negativity?
Well, one thing, this person doesn't say whether they were vaccinated or not.
Right.
Let's assume they were vaccinated, and then they had the Abbott test was positive, and then by the time they got into a clinic, the next test was negative and a PCR was negative. That would not be impossible at all, because those infections post-vaccination, you may only have the PCR or the rapid test positive for a day or 2, and then they are negative. We did that study, Northwestern, called COVID Detect with the University of Illinois, Champaign-Urbana, and we were seeing that in these vaccinated people and stuff that had very limited test positive periods, even though they had some symptoms that lasted a few days. So it is possible. The loss of smell is really very suspicious for having COVID. Now, the other scenario is, okay, the person's not vaccinated. I would think if they were not vaccinated and had this whole scenario with the negative rapids and the PCR at the clinic, that those 2 tests originally were false positives. So the scenario could be either way. The PCR test is the confirmatory test, but again, it depends how much virus you have in your body, and if you are vaccinated, it could be very little. So either way with that one, but fortunately, the person seems to be doing well.
Wonderful. Now for our last question. This family got their COVID boosters last week, so I'm assuming about 2 weeks ago. Their husband suffers from arthritis. They take Humira twice a month and was given a full 3rd dose rather than a booster dose. Is this possible, Dr. Murphy, to be getting a full 3rd dose rather than getting a half dose?
They're getting the 3rd dose because that was approved as an immunocompromised 3rd dose. There's a separate EUA for that. And that's certainly not going to hurt. I would think that was probably a good idea.
Wonderful. Those were all of our COVID questions for today. Thank you so much, Dr. Murphy.
All right. Have a good day.